weight training and muscle building, especially for women and even some of the non-gym bro men, we're just starting to now kind of normalize it. I think it's great. Maintenance of muscle mass during weight loss, having more lean body mass on your body is just extremely beneficial to straight up longevity. The fact that if you're losing inches and the scale's not going down, that's actually a really awesome thing because you are simultaneously burning fat and building muscle mass. Let's just clarify that one right there. It's extremely important to build muscle mass for our health. In the context of weight loss, there are multiple different ways to train. But if we're talking about what is the best style of weight training to protect the muscle mass the most, maybe even build a little bit of muscle mass during your weight loss journey, that's when we get into hypertrophy style training.
Now that we're talking about weight, a height to weight index, I know exactly how I feel about that, but let me get your thoughts.
Oh my gosh. I think build a little bit of muscle mass during your weight loss journey. That's when we get into hypertrophy style training.
Now that we're talking about weight, a height to weight index, I know exactly how I feel about that, but let me get your thoughts.
Oh my gosh. I think
With all the excitement around weight loss and these GLP-1s, it seems like we're hearing about dietary intake and calorie counting and the right types of cardio to do, but there's so little information out there. And even when it comes to questions, not a whole lot when it comes to weight training. And it almost feels like there isn't the connection for a lot of people understanding that weight training can be so valuable, especially when it comes to long-term fat loss. What are your thoughts on everything going on there?
Oh my gosh. I think we're starting to get past the point in society where lifting weights is and working on your muscles is no longer just a bro thing, and a gym bro thing or, a bodybuilder thing. And it's a health thing, and I know with my audience, I'm talking to primarily women out there, and even more so for them, the stigma is so real. I don't want to get bulky. I'm not worried about that. I want the slim and toned figure, right? And weight training and muscle building, especially for women and even some of the non-gym bro men, we're just starting to now kind of normalize it. And I think it's great because we are seeing the amazing health benefits that lifting weights and having more lean body mass tissue does. And we should be clear, it's not just the act of lifting, although that's kind of nice for exercise, but the building of muscle mass or the maintenance of muscle mass during weight loss, having more lean body mass on your body is just extremely beneficial to straight up longevity. And they've already proven that. And some really, really good research has come out on that. Yeah, I think that's why this is becoming finally more ubiquitous slowly, but steadily, which is good.
Yeah, and you mentioned the rates and all cause mortality statistics, which are incredible. And you hit the nail on the head. You said adding lean weight and adding muscle. And I think when a lot of women hear that, they think size, they think bulk, right? I've heard hundreds of times from women, I don't want to lift because I don't want to get bulky. And I'd turn and I'd face the gym and I'd say, every single guy here is trying to get bulky, and most of them aren't. So what makes you think as a woman that you're going to do it inadvertently, right? Without direct training and an actual goal and a precise plan. But there's, again, still that fear because people don't realize a pound of fat is what? About the size of a beach volleyball, and a pound of muscle is the size of a tennis ball. If you're building one and losing the other and displacing your weight, the inches are going down. And you see the scale, your doctor sees the scale. That's about it. We're not walking around with a big number above our heads, but it seems like that's how a lot of people feel nowadays.
100%. To break that and to get comfortable with the notion of the scales and the numbers not changing, I think it does really start with an understanding of the difference of the density, like you said, and the fact that if you're losing inches and the scale's not going down, that literally means it's actually a really awesome thing because you are simultaneously burning fat and building muscle mass. Let's just clarify that one right there. Because in for our weight loss programs, this is why we are requiring both the weekly weigh-ins and the weekly measurements, because before we assess if somebody's in a weight loss plateau after 2 weeks of not losing weight, we then look at the inches. And we're talking people that are starting in the obese category or very overweight, right? So at that point, we are looking at heavy, weight loss. We want to see the lbs and the pounds come off. But for anybody watching this that's already kind of done that, then we really need to start paying attention to just measurements, because the measurements alone moving, and even for the ladies watching this, you know, I just had a call today with somebody and we were talking, and you know, she's 127, she's great results, right? And she goes, you know, Dr. Jones, I just want to be 125. I think I'm going to look really good. And I'm like, okay, so where'd that number come from? She's like, I mean, you know, if you don't mind, I think you just pulled that number out of nowhere, huh? Like you just, you know, it's arbitrary, right? And she laughed. She goes, yeah. I was like, look, you know, you pulled that from somewhere. Obviously, you have this preconceived notion that at 125 you felt really good and you looked really good. She's like, yeah. I'm like, exactly. If I got you to 132 and you looked even better, would you give a shit about the 132? She's like, well, no. I'm like, okay. You know, and this is really, really important to understand. And it's so, I mean, it parallels what we're talking about right now, right?
It does. It does. And going into the misunderstood pieces of resistance training, BMI, now that we're talking about weight, a height to weight index, I know exactly how I feel about that, but let me get your thoughts.
So the BMI, you know, gets a lot of scrutiny now from the camp of individuals that understand exactly what we're talking about. But so the BMI is great if we're doing research, if we're looking at a group of individuals, if we're looking at large populations, because it is effective enough in that context and it's really easy to do, right? Height and weight, it's a ratio of the two. So that's great, right? But when we try to apply it to an individual and use that as an assessment of whether they're healthy, metabolic health, which is what we're talking about, but really just overall health, it's pretty poor. In fact, another really easy metric that's significantly more impactful would be the waist to height ratio. And that's got a real lot of data behind it, because I think people don't talk about it because we're barely starting to understand visceral fat. You know, so it's important for us to define that. So visceral fat is the fat in our body that is within the abdominal cavity and it surrounds the organs. And this is detrimental to our health. And it's like once we started learning about it, it's like, oh my God, this is bad. And then this is really bad. And like, oh my God, this is like really, really bad. I mean, literally, there is people looking at the pathophysiology and development of diabetes and looking at how a fatty pancreas, which is one of the organs, tiny little organ, that's what you're going to see in that pathophysiology and the development of diabetes. And, you know, I was listening to a great podcast with Dr. Ken Berry, and he was interviewing, I can't remember who he was interviewing, but somebody who studies MRIs all day. And unfortunately, right. And he even said, like, I get it. Like MRIs, that's not, yeah, talk about a roadblock of being able to get a test done compared to just a height and weight ratio, right? So, but he's learning a lot, and it's important. And so, you know, but even X-rays, for example, right? The radiologists wouldn't even look at a fatty pancreas, because you can actually see the on an X-ray specifically, or an MRI, you can tell as a professional reading this, the presence of fat on the pancreas, for example, and they wouldn't even call that an incident. That wouldn't even be recognized, right? And so, you know, he was talking about how he literally called up some radiologists and say, why wasn't this reported? And it's like, well, we don't ever report that. We see that all the time. It's because we have a lot of people that are becoming diabetic, and you literally could be catching this kind of stuff earlier. So our whole understanding of visceral fat is just, I think, in the early stages, but we know how detrimental it is overall. And so, you know, going back to the BMI, I absolutely would not use that for anything other than, I will say this: if you're starting your weight loss journey, the only thing we'll use the BMI for, if the patient's just like, I don't even have an idea of a goal, it's like, okay, what does the BMI say you should weigh? 1.25. This is Dr. Jones' coefficient of BMI. 1.25 gives a pretty reasonably good target, because when we're losing weight, we're protecting muscle mass significantly more than where those BMI metrics came from, right? Those BMI metrics came from just standard weight loss, and standard weight loss, you know, we've done plenty of other episodes talking about this. Standard individuals have much less lean muscle tissue, and so they expect to see that much muscle mass. So I think for like a 6-foot individual male, it's like 180, you know, it's really low, because any man at 6 foot with just a decent amount of muscle is going to weigh more than that. So Dr. Jones coefficient 1.25 gives us a range, gives us a quick range of what to shoot for. But then as we get closer, I could care less about the BMI anymore. So
I do like that because you could be a male that's 5'10" and weigh 215 pounds and be morbidly obese, or you could be a running back in the NFL, right? And just have a ton of
or
muscle
you could.
mass. It could be either.
Oh,
When
I
it
know,
comes
I know.
down to figuring out what your body composition really is, what is your favorite tool or favorite resource? Um, are you okay with electrical impedance? Do you think that you need hydrostatic? The pod? Do you think either are okay? Where do you lean?
Well, it sucks, right? Because, we're all virtual, telemed. And so in this capacity, when we're helping patients, we literally, we're using weight and we're using measurements. And it does a really good job. Ideally, a DEXA scan and a hydrostatic test would be pretty awesome if you can get that done twice a year, quarterly, or monthly if you have the time. They're reasonably affordable, 75 bucks. If you're watching this, just Google hydrostatic and DEXA. You'd be surprised. Actually, they're becoming more popular. Oh, I have one right down the street. There's several in the Denver metro area. So unfortunately for anybody in the rural area, good luck. But so a DEXA scan is actually like a specialized type of X-ray machine, but it specifically uses a kind of a different technology than your standard X-ray. When you take an X-ray, standardly they're more concerned with bones and or lack of thereof, and they can radiologists are interpreting that for whatever issue, fracture or some sort of pathology. But a DEXA scan is telling us giving us a good reference of how much lean muscle tissue versus fat mass. And so it takes like 10 minutes and it's like I said, usually 75, 80 bucks, really accurate. That's why I would love to do it. Just again, a little impractical, probably don't need it as often and we can't use it that frequently. There we go. So it's almost like a confirmation for the other metrics that we use. Same thing with the hydrostatic. Hydrostatic, that's immediate, right? So you go into a tub, and because of your body's displacement of water, it's actually kind of crazy how that works. Like the accuracy of hydrostatic is actually really high, but an individual who's got more fat mass has a different buoyancy in terms of buoyancy being how floaty you are. Is one way to think about it. So versus a lean muscle guy. So unfortunately, Dr. Jones, when I'm swimming, it's a lot of exertion for me, and I'm sinking. And so the displacement of water is very different from somebody who's got a much higher fat mass. So you get in the tank, it's instantly they have the little apparatus next to it, and they can instantly tell based off once you sit in there and you relax, plugs into the algorithm and it spits out the number. But then it takes about 10 minutes to dry your body up. So all in all, they both take about the same amount of time, and they usually cost about the same amount. So definitely recommend anybody, if you had never Googled hydrostatic or DEXA, to go look for one locally. But truthfully, you're not going to do that as often as I would like to. I would like to have a metric when I'm helping somebody, or if you're doing it on your own, that we can do on a weekly basis. And your only options are obviously weight, pounds, measurements, and then that electrical impedance. So we'll talk about electrical impedance in a second. If you are working with a clinic locally and they might have the technology in their office, it's pretty common. It is more of a three-dimensional picture. It's actually pretty interesting. We used to have one ourselves, and you can see the Xbox technology in there, the actual video gaming system. But just a camera. It's a really good camera that's set up on a pod that rotates 360 degrees, and it takes pictures. And I've seen smartphones have apps that do that. I've seen suits that you can put on that have, I guess, positional sensor. So there's a lot of different versions of this same idea, which is essentially you take a picture, you get measurements around all different aspects of your body, and you plug it into algorithms. Now that I would say we're working our way down in accuracy. Okay. So DEXA scan, hydrostatic, the highest, and then you have these three-dimensional pictures with each of them having varying levels of accuracy. I don't think the smartphones are going to be nearly as accurate as the $5,000 machines I used to have. And I'm not even familiar with the suits. I've just heard of those. For an individual who's not lean, those can be pretty good. Those can be pretty accurate. And if you have a local clinic, that could be easier just to swing by, get a shot, and leave, So those would be cool if you have access to those. Other than that, though, on a weekly practical setting, we're left with the measurements and we're left with weight. The electrical impedance, I truthfully think that those, and it's so funny, right? Because, me and you both, the gym days, we use those all the time. And we knew how inaccurate those were.
Yeah.
I mean, those were not the most accurate, unfortunately. So I honestly, because of that, I just advise patients to stay away from those. Calipers, awesome. But now you have to have an individual that's doing it on you who knows what they're doing and who's consistent. So not too difficult to get your partner to be trained in it, and if they could, then great. Practical a little, impractical a little bit, and so and I end up faulting on circumference measurements and weight. That's great on a weekly basis, looking at the trends, and we can go from there.
Yeah, I like that. And let's get into actually seeing results in the gym, starting with nutrition, calorie breakdown, protein intake, hydration, timing. How do you work that out?
Yeah, I think so. Why don't we start with muscle building in the context of weight loss, and then we'll get into just deep, like what is muscle building, and the name hypertrophy. Hypertrophy means muscle building, and so we obviously talked earlier about getting past the stigma of it and understanding that it's extremely important to build muscle mass for our health. Now, the funny thing is, most people watching my podcast, is looking to lose weight, and so they're not this young male trying to put on 20 pounds of lean muscle mass. It's like, why are we talking about this? And why are we talking about muscle building? Because in the context of weight loss, there are multiple different ways to train. And a lot of personal trainers, we remember back in the days to ourselves, but a lot of the approaches towards lifting weights is trying to accomplish two goals. They're trying to accomplish giving you muscle stimulation, because we know that working the muscles out in a general sense is going to protect the muscle mass against breakdown during your weight loss. And we need that, right? Because in weight loss general, if you lose weight, you are going to lose a certain amount of muscle mass. So what you're trying to do is you're trying to optimize your weight loss to protect as much muscle mass as you possibly can. That's the goal. And hopefully we're going to get into basically everything that we possibly can do and know of to do that. But that's the game. That's the game we're playing. And so when you approach weightlifting techniques, if you are trying to also hit the second goal, which is burn as much calories as possible, which makes sense when you're looking at weight loss as calories in versus calories out. Well, let me maximize both. So circuit training comes to mind, even some of the CrossFit stuff. Not downplaying those workouts. Those workouts are phenomenal. They have a ton of benefits. They're way better than doing nothing. But if we're talking about what is the best style of weight training to protect the muscle mass the most, maybe even build a little bit of muscle mass during your weight loss journey, which can happen, especially if your hormones are optimized, that's when we get into hypertrophy style training, which is very, very different. Depending on the individual's sort of propensity to sweat, most people don't even sweat unless they're in a humid, hot area with proper hypertrophy training. And that truthfully is going to protect your muscle mass the most. And I'm such a big fan of that because, we incorporate so much fasting into our approach for lasting weight loss anyways, that I'm, for my patients, I'm like, look, you're burning as much calories as we need to on a weekly basis. Your deficit's high enough. Like, we got the fat burning coming from the fasting. Let's take this time and let's stimulate the muscles as much as we possibly can. And we'll get into that later, what hypertrophy looks like. But I just wanted to be clear what that is still the approach that you want to take during your weight loss journey. So I think that was just absolutely worth mentioning.
Absolutely.
Okay, so what are the other variables, right? So protein intake. And protein intake is much easier to it's one checkbox that's much less effort than actually getting to the gym and training, intensely for 3-4 days a week. It's just get enough protein in. I wanted to interrupt this video to let you guys know about the free weight loss guide that I have. I'll link to it in the show notes. This is your GLP-1 weight loss guide, specifically teaching you guys how to crush those nasty GLP-1 weight loss plateaus, how to continue to get the results that you're looking to get without having any horrible side effects, and of course, avoiding long-term complications. Again, I'll link to it in the show notes. And now back to the show. And this is becoming such an issue, I think, mostly because the GLP-1 medications are just so powerful. They're suppressing people's appetite. I see it every single day. We get so many people coming to us and they're freaking, zombie mode, which is what I call the weight loss plateau. The metabolism's downregulated. They feel like shit. They're losing muscle mass. They don't look great, and they're not getting enough protein in. And so getting enough protein is probably the easiest box to check. And so a simple formula is 1 gram of protein per pound of target body weight. You can go up to current weight, and if you're really overweight, that's probably definitely overkill, but it's not the end of the world. If you don't have chronic kidney disease, your body's going to very easily just convert that extra protein intake via gluconeogenesis into extra energy. And protein is very satiating, and so it's not a big deal. But If you're struggling, this is where protein powders and protein supplements come into play. Of course, ideally, I want our patients getting as much whole food as natural protein sources from food as possible. But in a pinch, that's where protein supplementation can come into play. So get enough protein no matter what. Freaking has to be 80% powder. Not ideal, but we'll tackle that bridge later, replacing the protein powder then. But right now, we just like, especially at the beginning, we got to get enough protein. Okay, so we got the hypertrophy, we got adequate protein intake, but we have to talk about adequate calories because it's confusing when you think of the individual who's literally trying to maximize muscle building and actually gain weight, right? Whether it's an athlete, whether it's aesthetic, you got to be in a caloric surplus with adequate protein, adequate training. But in the weight loss context, it gets really confusing because, well, I have to be in some sort of calorie deficit. And, that gets really nuanced because are you doing our approach with the hormone optimization or just straight calorie restriction? Whatever it is, there's a calorie restriction. But if you restrict your calories too much over too long of a period of time, even with adequate protein and adequate training, you will still create that signal to the body and you'll end up losing more muscle mass than you would otherwise. This is why when it comes to your caloric restriction approach, whatever it is, whatever philosophy you believe in, whether it's ours and you're utilizing more fasting and working on the insulin pathways and fixing insulin resistance versus just steady old state caloric restriction, we probably don't agree on much, but both parties would agree calories versus hormones, the restriction shouldn't be too much. The caloric restriction shouldn't be too massive because that'll create a real strong trigger for greater muscle mass loss.
Do you typically have a consistent protein, carb, fat breakdown generally for weight loss?
I don't. And that kind of plays into working on hormones, specifically insulin pathway for weight loss versus just caloric restriction. When you're focusing just on calories, then your macros kind of play a bigger role. But trying to count and quantify your macros is just like quantifying calories. It makes it even more tedious. And so no, I don't have to worry about that. In our approach, it's getting enough protein is sort of some conscious effort on that. And then we do recommend a low carb approach for the certain first amount of months. So some attention on that, but very loose attentions, but still some attention. But overall, yeah, I'm not worried about anything in terms of really tightly fine tuning the macros. It's just not necessary. There's bigger fish to fry in this weight loss equation.
Okay, and how about timing the food or intake?
Well, intermittent fasting is a staple and fasting is such a huge piece for me. So in the context of muscle building and muscle preserving, we follow our guidance and approach towards fasting, and that doesn't change as far as this us wanting to protect muscle mass. In fact, if we have time, we'll get into hormones. The long fasting will actually optimize the hormones. And so we want to keep the fasting in, even with our attention on muscle mass. And the real big key, again, is we kind of mentioned it, just getting enough protein outside of that window. So,
Gotcha. So let's get into the application part of things and how to actually see results in the gym. What are the biggest successful actions that you can identify for people who actually do some success?
yeah, and I think, we covered everything but hypertrophy, and I'd love to see you get into this actually because I know you have a real strong background in the training, resistance training, and so the last piece of it is, well, what does hypertrophy look like? We talked about all the non-stuff, right? The stuff that complements it, but what is actually hypertrophy, if you wouldn't mind getting into that?
Yeah, the first thing to understand is anyone who's been a member of a gym for a long time, regardless of when historically, I'm sure they've seen that person that's there every single time they are. You're in the gym, they're in the gym, and weeks go by and months go by, and you realize that person hasn't changed, right? And now that's a unicorn because they're actually being consistent. But most people, look, if you're going to the gym consistently with no results, it's like having a job with no paycheck. You're only going to show up for so long before you stop. And it's why gyms are so damn successful. The last time I saw the study, it was the average person with a gym membership works out 2.7 times a month, but they're collecting the gym is that monthly membership due, right? So how do you avoid being that person? Because if you're seeing results, you're staying excited, you're dedicated, you're getting complimented, you're happy with who you see in the mirror, right? It's all these positive reinforcing actions. So step number one, you have to do resistance training. You have to do hypertrophy. Cardio is not enough for a simple fact, afterburn. When you're lifting weights, when you're causing hypertrophy, what's actually happening is you're causing micro trauma. At a microscopic level, you're literally causing the muscles to break down, and your body, because it wants to adapt, it rebuilds more fortified, stronger, more able to handle that stress. But what also happens is because your body has to rebuild all that broken down muscle, you have afterburn. Your basal metabolic rate is elevated long past the time when you're done working out. And it can be up to 2 hours, up to 3 days. So you have somebody who goes to the gym and says, I'm going to kick butt today. I'm going to do an hour of cardio. On average, that's going to burn somewhere around 450 calories. That person could go to the gym, they could bust their butt, they could have a great sweat, go change, and on the way home, stop at Starbucks, grab a scone, and they just deleted that entire workout, right? You're never going to be able to maintain success that way because if you get sick, if you get injured, if you get busy with life, if you travel, as soon as you remove cardio from that equation, the weight goes back up. Something that has never really failed me over the years with anyone that I've worked with or anyone that my team has worked with, keep the volume a little bit higher and keep those rests low. They're called supersets or giant sets. But when you're continuously pushing yourself, let's say keep it simple. I'm doing this at chest press, sitting down, I hit my limit. Instead of resting, I'm going to drop that thing by 10, 20 pounds. I'm going to go till I can't go anymore. I'm going to drop it again and do the same thing. And not only do you maximize muscle breakdown that way, meaning you're maximizing muscle growth, which boosts your metabolism, and you're maximizing afterburn, which makes you burn calories long after you're done working out, but you're still getting a cardiorespiratory benefit because you're keeping your heart rate elevated throughout the duration of the entire workout. Never seen someone apply this concept and not see results because you're going to get some combination of a stronger heart, stronger lungs, better muscle, stronger muscle, and less body fat over time. And essentially that's what everyone's looking for. Now, problem number 2 is something that we talk about kind of a lot, which is a plateau. And we focus a lot on the metabolic plateau, the body being stuck at their set point, of course, but you also have the physical plateau. You have the muscle stimulation that's needed in new ways to actually further move. And here's a great example. Anyone who's played basketball, freshman year, the first time you play, it's very common to have to do free throw shots at the end of every practice. Most people are going to shoot 40, 45%. Sophomore year, junior year, goes up to 55, 60. Senior year, if you're really good, maybe even 70. But why is that? Your body literally memorizes micro twitches and small movements to the point where it becomes easier and easier, and you actually burn less calories doing the movement. So you apply that concept to the gym. Any person who comes to the gym and has a routine is going to hit that wall. That workout's going to get easy, and they're going to stifle their progress. But the converse is true too. And here's where it really gets crazy. I've seen people not work out nearly as hard as the person next to them. Less hours, less days, less intensity. But they're always doing something new. Something that makes them off balance, something that even makes them borderline uncomfortable. Those physiological signals, that awkwardness is a sign that your body is being challenged as it moves through space. And if your body's being challenged as it moves through space, you're getting more results that way. The best advice I ever give people is once you felt like you've mastered your base or your foundation, take yourself out of your comfort zone, start doing things that are new, because that is absolutely going to unlock the door for consistent results.
Like that. No, I think that makes a lot of sense. And I don't think a lot of people are thinking with that. What about when you talk about just kind of the basic structure, the rep range? We understand intensity now. So what about rep range and rest? So because you can do different styles of, different lengths of rest, different rep ranges. So let's get some of like that backbone and structure of what you would strive for hypertrophy.
Yeah. So for a rep range, we're going to stay away from that pure strength volume series. So you're not going to be doing any sets of 3, sets of 5, anything like that. Pretty much every movement should be somewhere around 50 to 25 reps to failure every single time, which is really, can I have correct form? I complete the movement throughout the entire range. As soon as form breaks, that's your end point. You don't push past that. That's when you actually drop the weight. Now, when you look at sets, you want to do 3 to 5 before any type of rest. That can be 3 to 5 completely different movements back to back. Let's say you're doing an antagonistic workout where it's a chest back, you're doing a push movement. You go right to a pull movement as your chest rests, right back to a push movement, right back to a pull. It could be the same thing in one movement or one machine or one exercise selection where you're simply just dropping the weight. Now, when it comes to rest, similar to HIIT training, a good barometer to set is the talk test. If you can have a conversation like we are now, and you don't have to take breaths in between that are pausing your sentences, you're ready for the next set. You've restored enough glycogen to then go on to the next movement and you hit it hard there. Now, for total duration, you can actually have a pretty successful workout, as you know, in 17, 20 minutes if it's hit. But realistically, the average person is going to need to be moving for at least about 40 minutes to really get everything in that they need to see those consistent results. But do not conflate hard work with time spent. You can be in the gym all day and not do nearly as much as somebody gets done in 40 minutes, right? You know this.
Yeah, this so true. So what would you say then with what you saw with everybody that you trained? Because this approach to me does seem more aerobic, but I know you've trained a lot more people than I have. So how does this compare to sort of the 8 to 12 reps, hitting that muscular failure, or at least one muscular failure, resting for 90 seconds and then doing the next set? One set with a rest as opposed to 4 sets, like you said, different exercise. It's very different. And so I don't think I've ever actually asked you this off the record. So what is this? We're going to ask you for the first time on the record. How do you compare and contrast those two as far as, goals?
Anyone who's doing the method where it's a set and rest, probably going to build a little bit more muscle. Most likely that's just the way it goes. But I would venture to say that 90% of people are more out there. Even if they want to build muscle, they want to lose some type of fat, right? The average person is not in a place where it's only muscle build and I'm 10% and I'm great there. And when you increase the intensity, you're just getting more ROI out of your workout and you're getting healthier. And there's always going to be time later to focus on like just the strength or just the weight. But when you increase your body's function, when you're training for volume, which is going to limit injury and help with stabilization muscles, those smaller muscle fibers, you're unlocking this door to a new realm of physical activity that you wouldn't have been able to accomplish previously. And I think that's really what it comes down to is you're giving yourself a really strong, healthy, athletic foundation. You're not just getting strong, you're not just burning fat, right? It's all inclusive. And that's what is going to pay dividends for the rest of your life. And I think that's why I really gravitate towards so much is because it turns you into the UFC fighter physique, the volleyball physique, not the non-functional bodybuilder look.
Totally.
Now, there is something that I kind of want to clarify because I'm talking to a general audience here and not saying that the other methodologies don't work. What I am saying is most people aren't going to get a trainer, really learn perfect form, real muscle engagement, real muscle brain connection. And because of that, I know that a way to override that is through repetition and intensity. If you could perform perfect sets, you knew that you were getting to complete failure with great form every single time, and you could perfectly divvy out your rest periods, and that absolutely is going to work. But that person is probably still going to have to do cardio afterwards as well, and maybe spends a little bit more time in the gym to maximize results for the time spent and average education that somebody has, especially biomechanically. I can tell someone, hey, stick with machines that you're comfortable with, stick with calisthenics that you're comfortable with, do 3 to 5 sets, then take your break in between. And I can be pretty confident that even without somebody watching the entire time, really honing on their diet, they're still going to see some pretty good results.
Yeah, I think that makes sense. I think the nuance of that and your average person isn't doing flow. I mean, I think that's the key. My goal is, global domination with the protocol, right, of getting people into deep fasting. But yeah, I think like a lot of people are not fasting that much. And so, yeah, I agree with that. Absolutely. 100%. If you're not doing deep rounds of fasting, I could totally see that you need that extra calorie burn. You need that extra energy push. And especially because the post epoch, that extra calorie burn afterward, absolutely. I mean, whenever I do workout like that, I'm exhausted, for sure. So yeah, I actually agree with that 100%.
And if anyone out there is willing to invest in a time with a personal trainer, I would highly recommend getting some type of movement strains. There's something called an inline lunge. You've heard of the overhead squat assessment. There's the hurdle step, but there's a series of movements you can do to identify which muscles are overactive and which muscles are underactive. Every muscle has an opposite, right? As my bicep contracts, my tricep has to extend, and vice versa. There are no muscles that don't have something that complements them. And we can definitely overtrain certain muscles to where they're too signaled, they're too active. The opposing muscles aren't strong enough to pull them back into place. And over time, it causes some pretty gnarly postural issues. Guys who only do mirror muscles, they do the biceps, they do chest, not nearly enough back. And what happens, they walk over with some internal rotation and they're hunched over. And we both know years later that can lead to kyphosis, right? And that's just one small example. Understanding if you're quad dominant, understanding if you have glute amnesia, if you have a calf complex, spending most of the time 3 to 6 weeks correcting those could literally mean a lifetime of less pain and definitely a lifetime of less chance for injury. When you have a system that's push-pull and it's unbalanced, that wear and tear is what causes injury over time. Quad dominance is one of the leading causes for knee pain, right? So get somebody who knows what they're doing, who can put you through a movement test and tell you, hey, work on these muscles a little bit more, and let's foam roll or let's trigger point, let's relax these other muscles so that when you combine your movements together, you don't have one that's too strong, one that's too weak, and then you're just increasing that bridge over time.
Yeah, I think that makes a lot of sense. Yeah, I mean, shoot, I need to go do a high repetition workout now just to kind of switch it up too. That variability thing is key too. I think that varying it up every now and then too as well. I know we're pretty much out of time. The thing that is also important to understand, and for anybody watching this, we have so many other podcasts and videos on hormones and what they do in the background. They're very, very powerful, but they truthfully should not be the solution to the problem of needing more muscle mass or protecting muscle mass. They should be the optimizers, the base that's so much more affordable. Getting the solid hypertrophy approach, the solid approach toward weight training, being consistent, having the intensity, consuming adequate protein, not getting too much into a caloric deficit. We didn't even have time to get into sleep, but that's the next thing that would be extremely important. But yes, when these things are dialed in, you can absolutely have a testosterone panel. And as a man, if you're far from a total level of testosterone, you're say less than 600, 500 or lower, and you have some of these symptoms of low T like brain fog, anxiousness, depressiousness, lower motivation, lower sex drive, less responsiveness to workouts, then testosterone therapy can absolutely complement. And then there's growth hormone peptides too. As we age past 35, growth hormone levels drop, which would be a nice way to really enhance the results, assuming these things are dialed in. So regardless, the end note I want to say is, whether you're trying to build muscle mass or just trying to lose weight, it's important to get these variables dialed in. And if you are trying to lose weight, understanding that it's no different.
The rate of success that you're going to see with optimized hormones is, of course, going to be not only better, but you're going to feel better going to the gym. It's going to make you more motivated to just get out there and do things. So you absolutely should get your hormones tested if you haven't. Awesome. Thanks, man.
Without a doubt. We'll see you guys later.